Hello, my name is Dr. Brian Raid, and I am a naturopathic doctor. And this is a video about a low-dose immunotherapy being used for a case of psoriasis. Psoriasis is really, really tough to treat in some cases. Granted, some cases do respond beautifully to modifying diet to remove food triggers or pro-inflammatory foods. Sometimes healing up gut issues will resolve psoriasis. Sometimes working with immunomodulating substances or antihistamine substances, mast cell stabilizing substances, different things like that will help. There's topical agents like topical ozonated ointments or topical herbal blends with calendula and symphytum and things like that that can be helpful. So there's lots of things out there that can clear up psoriasis. And then sometimes none of that stuff works and it's just really, really frustrating. Or patients will find that when they their psoriasis is doing a lot better, it goes away, but then if they stray from the certain dietary restrictions or whatnot, then it starts to come back. So it can kind of be put into remission, but it comes back. And of course, some folks use steroids, and that works. It can work, but same thing, if they stop the steroids, sometimes it'll come back. So psoriasis can be very persistent and frustrating. So one of the many, many, many reasons that I'm so happy to have low-dose immunotherapy in my tool bag is because sometimes it can be really helpful for treating psoriasis. So just a little case, uh, share an experience from a recent case, some feedback that I got from a patient. So this patient had been suffering from, with psoriasis, and it was really surprising and strange because I'd been working with this patient for a while, maybe a couple of years. The patient had a lot of digestive issues, figured out that there was SIBO and some LIBO, SIBO being small intestine bacterial overgrowth, LIBO being large intestine bacterial overgrowth, and between some fairly modest dietary modifications, some antimicrobial herbs, digestive issues, constipation issues, things like that just got better, and the person was doing just great. And then oddly enough, just seemingly out of the blue, started developing psoriasis. And developed that on some of their limbs, around their elbows, and on their scalp. And so, and then sometimes the phone falls off of the perch that you have it on. The story was just too exciting. This is proof that I don't edit any of my videos because I'm not going to start this again. So the patient was having developed psoriasis in these areas, so it was a bit surprising because they were already doing better health-wise overall. And so we brought in some support for their lymphatic system, a little bit of detoxification support, got some topical ozone in the mix, and it didn't really help, unfortunately. So sometimes those things help a lot. In this case, it was a swing and a miss. The psoriasis was getting worse over time, and so the patient saw a dermatologist, got some topical steroids, and it helped. It helped quite a lot. Got things probably 90% better. But the patient found that whenever they tried to back off on the steroids, then everything would just come roaring back. So they stopped, went back on, stopped maybe 4 or 5 times, and just kept coming back. So they're kind of frustrated and a little bit concerned because long-term topical steroid use is not ideal. So the patient, so I said, okay, well, we tried a lot of the basics, have a lot of things in place. Why don't we try some low-dose immunotherapy, because that might work. So I recommended a low-dose immunotherapy formula for skin fungi. So this formula has several different skin fungi, some mold in it as well. So basically these are just fungi that live on the skin. But if a person's immune system's wires if the wires of the immune system get crossed in a person, sometimes they start reacting to microbes that otherwise they shouldn't react to in an inappropriate way. They'll start developing an inflammatory response to those microbes wherever they happen to reside. And in this case, it seemed to be, I thought it might be to the fungi on the skin. So I recommended this fungal formula, low-dose immunotherapy preparation. And after a couple of months, we had a follow-up visit, and was very happy to hear that the psoriasis improved even further. So it was even better than when, because the steroids improved things about 90% of the way. So skin was doing great. There's just a teeny tiny little bit left on the scalp, and the person hadn't needed to use topical steroids for about the previous 6 or 7 weeks, so just started working almost right away. And there were actually periods where the psoriasis completely went away, but there's just a little patch that would kind of wax and wane a little bit. So my suspicion with that case is either that they need a little bit of a higher dose of that fungal formula, or I wonder if maybe there's some underlying food sensitivity trigger that we just haven't fully elucidated yet. And so either we can dig a little bit deeper with maybe an elimination, like a mini elimination diet, where we cut out some other food triggers, possible food triggers like corn or eggs or things like that, or we could try using some food low-dose immunotherapy or food low-dose allergen therapy to just do some broad spectrum desensitization to foods that the person might be reacting to, and that might get the skin better the rest of the way. So, or the SFF, the skin fungal formula, just needs a little bit more time, or again, a little bit of higher dose. So I just wanted to share that case because it's fairly recent, and it's just so gratifying when a really tricky case gets better, and it's just so gratifying when patients are able to achieve the health goals that they're setting out for, and in this case it was fully resolving the psoriasis and getting off of the steroids. So if anybody has any questions or comments, feel free to leave them in the section below, and otherwise I hope that this was interesting.